Good morning, everyone. Today is a very wonderful day. Good morning, Canada. Good morning, all of the women leaders and all women in our community. So we are starting our International Women's Day event. You know that every year Sawro did it in a community with a big, large group, the International Women's Day event. I remember the last year when we tried to do it in March 16. Before that time, the pandemic hit us. So we could not do it. But I remember that we attended a rally with all of you at Oasis. That was the last International Women's Day and last gathering that Sawro did. Because of the pandemic, we cannot be together. But that doesn't mean that we cannot work together to defend the rights of the women in Canada. So today's International Women's Day theme from Sawro that we want to do it, that how we can build back better the society with the voice of racialized immigrant women. We do not want anyone going to be left behind. So we started this event today with all of you sisters in here. Sawro's women leader will do some presentation. Sawro's some activists will want to do some presentation, and some community partner in here, they will do the presentation. So we are starting right now. I'm not going to talk a lot, but I want to hear from everyone. So I'm going to request Zinia to start the program and introduce our wonderful speaker before the talking.
Good morning, all. It's a wonderful sunlight outside, and I feel so honored to, as the anchor of this International Women's Day. So, all the women in this world, I want to salute you all. Happy International Women's Day. Women of the world want to deserve an equal future free from stigma, stereotype, and violence, a future that's sustainable, peaceful, with equal rights and opportunity for all. To get us here, the world needs women at every table for the decision making. We need all the women in the table. We need ourselves. This year, our organization is creating this community consultation to promote organizational theme is no one should left behind. We want to take the pandemic and build it back into our own hands. That we always doing that, like all years. The recovery agenda will discuss that we want racialized women. We don't want to go back to the previous normal. We want to show the urgency of new normal. Individually, we are all responsible for our own thoughts and action as a woman. Sorry. So, as a woman all day and every day, we can all choose to challenge and call out gender bias and inequality. We can all choose to seek out and celebrate women achievements collectively. We can all help create an inclusive world and community when women lead an example response to the COVID-19 pandemic were led by women. Let's take pandemic and build back into our own hands. So today, I'm Zinat. I'm welcoming you to our this International Women's Day event. First, I want to, as we know, Sultana. So I'm giving to the floor to Sultana.
Sultana. Zinia, just 1 second. Sorry for this thing. I just want to introduce yourself. Sorry.
It's okay, sorry. We can carry
Zinia has been involving with our organization more than 10 years as a chairperson, as a community activist, and a community women leader. Her contribution to the organization and community is outstanding and outbound. And she is personally work as a teachers in Bangladesh, and also have been working as a teachers in Canada. And she is always with us and supporting to alleviate the platform to talk about the gender equality in Canadian society. So you hear about from her about whatever you say. So I just want to say, Virginia, welcome to you. To sorry, I introduced you late.
No, it's okay. I think everybody see my face in all the time. So thank you anyway. Thank you, Sultana. So as you know, Sultana is the executive of Sawro and the heart of Sawros. So anyway, so I'm just to give the floor to Sultana. Sultana, Sawro's advocacy work on advancing gender equality pre-existing inequality impact during COVID-19. So welcome, Sultana.
So thank you, Zinia. First things I just want to say that we are in a very bad situation among the whole country, that we are hitting by the pandemic. Overall, everyone hit by the pandemic, but who hit more? That is the concern. The racialized immigrant women hit a lot. And as a racialized community, we, the Bangladeshi community, inside this community, we hit a lot. And before the pandemic, we have been working for all of this advocacy work collectively with the Sawro and with the community. I remember that we started the childcare subsidy campaign from 2010, and our demand was full funding for childcare subsidy. I remember we started the campaign for increasing the minimum wage to leave the living expense. That is 2016. And since 2016, Sawro have been working with other stakeholders to raise the concern that we need a very fair labor practices and a very strong labor policy. And we demanded that the community is attacked by the underemployment. And underemployment is the root cause of all the problems. Underemployment attacked Canada by two ways. One, underemployment that we are not getting job in our related field. Another, underemployment that we're forced to work in the sector where we are not getting Canadian standard labor law or Canadian standard life. Because of these two underemployment, we are undercovered, even though like we are skilled and medium workers. So since then, we just asked the government, do a national call for action, find it out why the underemployment still exists in the society and why this mass underemployment in here that a doctor needs to drive the cab or engineer have to work in the pizza. This is not acceptable. You cannot normalize these things in the society. We ask for the government that you find it out a remediation, and also we ask the government to implement the best practices that could minimize this underemployment. In that time, we also demanded restrict the temporary help agencies operation. I think everybody knows what is the temporary staffing agency. That is the staffing agency between the employer and between the worker, and grinding the worker and make a very slavery labor market. And this is not acceptable for our community, because our community is women, precariously employed women, those who work in this labor market every single day, beat by this inhuman policy. We raise our concern and we said that restrict this temporary help agencies for population. We ask for the economic incentive for the chaotic work scheduling. We ask for the third-party intervention for the non-unionized workers' right. We ask for the equitable access for social benefit. I really don't want to go details right now, because then I'm going to be talking only 2 hours. So we're going to do another event soon to raise this concern again, because Sawro is going to continue work to update all this recommendation and continue influence the policymaker, political leader to take up the issue and change the policy based on our needs. So I would like to request our women leader to present that what kind of impact we get it during this pandemic time in this society. So Zinia, we're going to introduce the speaker. Thank you.
Thank you, Sultana. It's very well said. And anyway, today Dolly is with us now, or no? Is that Dolly is with us?
Yeah, so but we can start with Kishore, please. When Kishore and Farhana is present, then we're going to do.
Okay.
So,
okay. Thank
Okay,
you.
no, we have to give the first speaker is Stephanie. So,
I know, I'm just feeling that Dolly is not yet with us, yeah? Okay, so thank you. So now I'm welcoming Stephanie Premji. Stephanie Premji is an associate professor in the School of Labor Studies, McMaster University. Her work focused on the working conditions, health problems, and access to care and compensations of low-income immigrants and racialized workers. So welcome, Stephanie Premji. The COVID-19 impact on racialized immigration women. Thank you.
Thank you so much. Thank you for the opportunity to speak today at this important event. So when the pandemic started a year ago, there were some people who called it the great equalizer. And with this idea that everybody was equally at risk from this virus. But it became very clear early on, and it's been painfully clear since, that the virus has had a disproportionate impact on racialized communities and on racialized women particularly. Now, some have tried to individualize the causes of these inequities. For example, some people have argued that there's a high rate of infection in the South Asian community because of big gatherings and religious celebrations. But we know from lots and lots of evidence on this that the pandemic, the COVID-19 pandemic, is directly linked to another pandemic, which is the pandemic of poverty and precarity. And the fact is that for many, there's no choice but to go to work on the front lines. So we know that racialized individuals are overrepresented in frontline jobs that are considered to be essential, which means that they can't stay at home to avoid exposures. And women are also more likely to be considered essential. So for example, if you look at the 10 most common jobs for women in Canada, 5 of these jobs are considered essential. And those are things like retail sales, cashier, kitchen and food services, healthcare, and daycare. And even within these sectors, racialized individuals and women in particular are more likely to be exposed. So for example, if you look at healthcare, just to illustrate this point, there was a study that was done in Quebec that looked at how common were COVID-19 antibodies among hospital workers. And they looked at 2,000 hospital workers. And what they found is that the rate of antibodies was lower among doctors. So among doctors, it was 7%. 7% had the COVID antibodies, which means they had been exposed to the virus. But it was 18% among personal support workers. And as you go down the occupational ladder, from doctor to nurses, to nurse aides, to personal support workers, the rate of antibody increases. Now, the other interesting part is that as you go down this occupational ladder, you also have more and more representation of racialized women. So there's really a pyramid structure in healthcare in Canada where racialized workers and women in particular are overrepresented at the bottom. And in addition to exposures at work, what we know is that these workers also face exposures at home in terms of denser housing, for example, and also in transit, because they're more likely than other people to rely on public transit, where they have to be in crowded buses, for example. Now, all of this happens within a larger context that places these workers at risk, and also that prevents them from speaking up when there is a problem at work. Sultana mentioned, the context of precarity and temporary agencies. So this context of poverty and precarity leads to people having to accept jobs that puts them at risk, and where they're facing things like lack of distancing, lack of personal protective equipment, shared washrooms and lunchrooms, and so on. So often the choice is between exposing yourself to the virus or going hungry. And so it's really, a situation where people have to pick their poison. What are they going to choose here, which is not a real choice. The other context to mention is the lack of regulations and enforcement. A little while ago, the Ontario government announced that they would be conducting more inspections in certain high-risk sectors, like distribution and housing. But the government directives also focused on worker behaviors in break rooms and carpooling. So there's quite a bit of focus on individual responsibility, on policing individual behaviors. And this is part of a larger focus that prioritizes business interest at the expense of workers' health. And the last thing I'll say in terms of context is the lack of rights and barriers to access to rights. Access to paid sick days has become a big political issue in Ontario. Previously, workers had access to two sick days, and this was revoked by the Ford government in 2018. So it is important to amplify the voices of racialized women so that they can help inform policies. And one way that we're trying to do this is by conducting a community-based project with the South Asian Women's Rights Organization. So before the pandemic hit, we had started to look at issues of precarious work and health. And when the pandemic began, we pivoted and we started looking at the impact of the pandemic on workers. And I want to read you one quotation from one of the women that we spoke to as part of this study. So she said, "It is required to maintain distance in a bus, but so many people board a bus that you cannot insert a needle between two people. I work 8 hours in a row without any washroom break or normal break. And after that, I walk 1 hour and 35 minutes to reach home. My feet got bruised. I did it so that my baby stays healthy. But I have to board a bus in winter because it is not possible to walk that long in winter to reach home." So what strikes me in this quote is how systemic issues like overcrowding on a bus, which could be addressed by increasing the number of buses, are being managed by individuals, in this case, having to walk home to avoid being exposed. And these problems are also being managed without access to resources like a car. And this, as the quotation illustrates, comes with a significant cost to workers' health. I'm just going to conclude by saying that these issues are very much gendered. There's more pressure on women. Women already struggle with getting jobs, getting good jobs. And data from Canada shows that single mothers and mothers with young children have left the workforce at unprecedented levels as a result of the pandemic. There are home pressures as well. We know that public health measures like closing schools have a disproportionate impact on racialized communities and women in particular. So I will stop here, but I appreciate the opportunity to hear other contributions to this event, and thank you again for the opportunity to speak today.
Thank you so much, Stephanie. It's really nice to hear from you. So now we are going to Kishore Lala. She will talk about economic impact on community and finance unemployment. So Kishore Laila is a peer outreach worker of Sawro since 2016. She has been with Sawro. Currently, she is working as a research assistant of a project doing by McMaster University and Sawro. And the objective of the project is to find out what happens when someone gets hurt or sick at the work and the work is not stable, so or secure. So please, Kishore. So I'm giving you the floor, Kishore.
Thank you very much, Jinat Bashar. So hello, everyone. Good morning. My name is Kishore Lala, as Jinat Bashar already mentioned, and I am a PR worker of Sawro. I have been in this organization since 2016. So now I'm giving you an idea of the economic and employment situation before the pandemic, COVID-19 pandemic in Oak Ridge and Taylor Massey neighborhoods. Before pandemic, Oak Ridge community's poverty rate was 40%, and Taylor Massey's poverty rate was 35%, while City of Toronto's poverty rate was 20%. So we can easily see that both neighborhoods were above the average poverty rate in Toronto. So the unemployment rate of Oak Ridge was before pandemic 15%, and Taylor Massey was 12%, while City of Toronto's unemployment rate was 8%. In here, we are also above the average of unemployment rate of City of Toronto. So we collected these data from City of Toronto website. So COVID-19 hit very hard to our community, already mentioned Sultana, Stephanie, everyone mentioned. So several organizations, including Sawro, tried to find out the economic impact of COVID-19. So Sawro did a research. I mean, beginning of the pandemic, Sawro did a research on community people, especially women. It found that the pandemic disproportionately impacted the employment status of women in the East Danforth community. COVID-19 pandemic hit very hardly to our community's women economically. Frontline and essential workers recognitions for wage increase and other financial benefits exclude all precariously employed immigrant women workers, especially at retail, manufacturers, and other hospitality sectors. Workers are in precarious labor markets didn't get recognition as frontline works during pandemic. So these details about this report will be presenting by my fellow colleague shortly. So Stats Canada labor market trends. Stats Canada published a report where they found due to pandemic, workers in retail, restaurant, manufacturing sectors and other goods producing sectors experienced a huge employment losses. Workers predominantly populating these sectors are precariously employed immigrant women, youth and other new labor market entrants. Temporary jobs and employees earning less than $16 experienced the greatest employment losses. So CIBC also published a report on February 2021. It named that unequal COVID-19 job loss report. So they posted this report posted by CIBC Bank. They found that all the jobs lost in 2020 among workers with wages below Canadian average. According to the bank reports, the greatest job losses were among part-timers, temporary workers, and self-employed workers. Racialized immigrant women bear the brunt of child care responsibilities, risk gender-based violence, and face economic uncertainty in low-paying precarious work, coronavirus pandemic. Last but not the least, Canada Women Foundation. They published a report and they said that COVID-19 is impacting women in a particular way, where you are seeing the ones who are more at risk are the ones who are least supported. Thank you.
I just want to add with Kishore that in this CIBC report, it also said that economic growth and wage increasing in the high-paid job more, but not in the low-paid job. So this is things like pandemic is giving an opportunity of some high-paid job to get blooming more and gain more, salary. And at the same time, it push some of the workers, those working under 16.03 per hour, so it's going so down. So it's creating, it shows that distance between rich and poor is getting so high, so big right now. Thank you.
Thank you, Kishore. Actually, very details in presentations. So now I would like to call Farhana Rahman. Farhana is a peer worker in Sawro as well, and she is actually involved long time with Sawro. Farhana will tell us the impact of housing, family life. So welcome, Farhana.
Thank you, Zinatapa, for the nice introduction. Just to add one more point, that I have been working with Sawro over 5 years. Now let's come to the main point. Housing is a key social determinant of health. It has become even more evident during the ongoing COVID-19 pandemic. Adequate and affordable housing and emergency shelters are of critical importance given the necessity of physical distancing in keeping people safe. Vulnerable populations experience higher levels of housing insecurity and unaffordability and have now been disproportionately affected by the pandemic COVID-19. Evidence shows that areas with a higher percentage of people with lower income levels and people from racialized groups had higher rates of COVID infection and COVID-19 hospitalization. Now let's see what was going on before pandemic. Rent was unaffordable before COVID-19. The average rent of one bedroom in this area is $2,000 with utility. Crowded housing is a pre-pandemic condition due to shared accommodation to make rent affordable. Intergenerational housing is a pre-pandemic condition due to youth poverty in this community. Landlord increases rent based on their profit mentality. The new tenant has one rate of rent, and the existing tenant has another rate. All high-rise buildings are not inspected very well to maintain livable conditions such as cleaning, air circulation, pest controls, and so on and so forth. Tenants face huge maintenance issues and negligence from the landlord to have healthy, livable conditions in the house. Women have to take care all caring roles of the family as well as society. The 5C jobs are caring, clerical, catering, cashiering, and cleaning. And there was a huge job loss and wage loss during the pandemic period. So let's see what happened during pandemic. Through our investigation, we have found an increasing number of rented households find themselves unable to fully pay their monthly rents and have fallen into arrears. Landlords provoke residents to pay rent on time while government freezes eviction during the first lockdown. Some landlords insist tenants to use the economic benefit to pay rent rather than think for other basic needs. Community families feel huge financial crisis to pay backlog rent while rent freeze was pulled up. Some tenants have paid their rent by taking on large debts, oftentimes at high interest rates, in order to keep a roof over their heads. Community families have experienced eviction threats while moratorium orders have been pulled out by the government. As a racialized community, we feel that we are left behind to fend ourselves without any financial support for rent relief. There have also been widespread reports from the community of increased intimate partner and other forms of GBV violence. Women continue to disproportionately carry the burden of caring labor and domestic labor at home. Now, what's the outcome? This time around, we are really seeing, certainly in this initial wave of layoffs, that this is a C-section as it's being called. Women are more likely to have part-time, precarious work with no sick leave or benefits, and they're also paid less than their male counterparts for the same jobs. The people that are impacted most are always the most marginalized. Now, is there any solutions? Yes, there could be. The rent, we already know that it's already sky high. So it should be made affordable right now by reducing it. And the government only can do it, right? And the government should freeze the limit and later put a ceiling on its increase. And another point is that there has to be more subsidized housing to help people to ensure a healthy lifestyle. It can reduce the waiting time and make it accessible to more people. Thanks, everyone.
Thank you, Farhana. So now I am going back to again the Sultana. Sultana is again agri-community response. So let's welcome Sultana again.
Okay, and so we hear it, that how it impacted us. It's impacted our economy, that we lost the job, impacted us to force in the unpaid work, that is the caring work, and impacted us that we are living in a very crowded house and intergenerational house, and we see the impact is severe in our community. I'm going to request right now to talk about the response, that what Sawro did during this pandemic time. We want to hear from our women leader that what Sawro did in this pandemic period. Please welcome our women leader to do this thing. Jinia, can you please introduce them?
Thank you, Sultana.
Sorry, 1 second. Before these things, we just want to hear from some political leaders. So we can hear from Mr. Bill Blair and also Mr. Bill Blair and also our MPP Rima, who is in here.
Okay. So MPP Rima is here today. She joined. Okay. Thank you, Sultana. So now I'm going to the guest speaker, Dr. Rima Vance McGowan is the member of Provincial Parliament for Beaches, East York. She is the official opposition critic for poverty and homelessness and a member of the Standing Committee on the Legislative Assembly. She has a long history of writing about that, advocating systematic changes, her creates equality and societies, and truly work for everyone who lives in them. So welcome, Rima, to our program.
Thank you. Thank you so much for having me. I'm sorry that I was a little late. I was rushing from something else. And mostly I'm really thrilled that you're doing this, and I'm thrilled to just be here, and I want to listen to what everybody has to say. And I want to say that, I caught a few words, and everything that I've been hearing here and elsewhere is exactly what my experience has been out in the community. Of course, the communities that have been hit the hardest by the pandemic are communities of working class, immigrant, Black, Indigenous, and other people of color. And also within those communities, as well as outside of them, women generally have been hit a lot harder than men, and women-led businesses have been hit harder. So generally, the hardest hit people of all have been women within Black, Indigenous, and other communities of people of color and immigrant communities. And they've been hit the hardest for many reasons, partly because, and we have the studies on this now. So this is not just anecdotal. This is, we've actually, a year into this, we have these studies, and we know that they have, as you always talk about, precarious work, precarious jobs that do not come with benefits, do not come with sick leave, that have no guaranteed number of hours or income, and that tend to be the first cut when there's a problem. So of course, women from the Bangladeshi community and other BIPOC communities have been hit because their income and income in their families was severely hit from the beginning. They lost jobs, they lost hours. When people in their families became ill, they didn't have paid sick leave. Often people live in multi-generational households, live in apartments like the ones in Crescent Town or Teesdale or Goodwood Park, where there are, few elevators, people have to get into them together. There's nowhere to self-isolate when people are ill. For all of these kinds of reasons that we know so well, these communities have been really, really hard hit by the pandemic. And you also know, as you've been pointing out, that when we in the opposition have begged and screamed and yelled for relief in all of the ways that communities would have been helped and women would have been helped, things like paid sick days are vital, because we can see the evictions happening. They have been happening by corporate landlords specifically since the very beginning of the pandemic. And as you know, the premier said right at the beginning, if you can't afford to pay rent and put food on your table, please put food on your table. Nobody will be evicted because of COVID-19. He lied. That has not been the case since the very beginning, when the eviction notices started going out as early as, I think it was still in April, when the building manager in Pinedale was running around with a debit machine, knocking on people's doors and saying, COVID is nothing, pay your rent. And then as early as May, people started getting N4 notices to say that because they had already missed either the entire month's rent or part of it. And the evictions, the actual process was frozen until August. Then the whole machine started up, became an eviction factory in the fall, particularly in November and December. And even when the premier shut down the sheriff coming to the door, the eviction hearings have still been happening at the LTB. It is absolutely cruel, and it makes no sense whatsoever. We have put forward motions asking for paid sick days over and over and over again. The government has refused to give them. We've put forward motions asking that evictions be ceased, and not just the sheriff coming to the door, but the actual eviction process. And now, this past Thursday, I put forward a motion that was debated to give people rent relief so that nobody gets evicted, because either they can't pay their rent on an ongoing basis because of COVID, or they can't get evicted for arrears for rent that they missed when their hours were lost when we were in lockdown. The vote won't happen until Monday the 22nd, this next week, where the House isn't sitting, but Monday the 22nd, we're sitting again. The vote, they will be voting against it. They've already indicated that. And their answer to me was so insulting. They were like, well, we've put money towards homelessness, so, we've already done our thing. We froze rents for 2020, 2021. But as you know, that freezing of rents, first of all, doesn't solve the problem, because AGIs are still happening and people are being hit with rent increases anyway. And on top of that, anyone who owes arrears and has an apartment in a corporate landlord-owned building is being met with eviction hearings. So it's really shameful. And one thing that I would ask everybody is to please get hold, if you have a member of provincial parliament, so not Dolly or me, but somebody who is a conservative and is going to vote against this, or you know anybody who lives in a riding with a conservative MPP, please get everybody you know to write to them, phone them, email them this coming week to shame them, so that on the 22nd, when the vote happens, they at least know that there's a lot of pressure to vote for this bill instead of against it. The final thing I want to say is that it makes no sense whatsoever for the government to vote against the rent relief motion. None, because we know that it is much more expensive for the province to support shelters than it is to keep people housed. It costs $6,600 per bed per month under COVID to keep a shelter bed going. Nobody's apartment that we're talking about here is over $6,000 rent a month, right? So the point here is it doesn't even make sense from the government's, from a money management perspective. And on top of that, it's just plain cruel. So I please know that I am fighting as hard as I can to keep people housed. This month, this coming month, or in April rather, I'm going to be going to the Landlord Tenant Board along with the Tenants Union in Pinedale and Goodwood to fight a sort of consolidated hearing of all of the tenants who have come together in a union who are fighting with an incredible law firm to keep them housed. And they put forward all of the arguments about why the LTB should not be evicting people, including the fact that the landlords did not negotiate meaningfully, which they're actually required to do by law. But so I will keep fighting. The Rani management tried to serve me with a legal letter telling me to stop talking about what they're doing and threatening to sue me. But it was such nonsense, and it was so obviously were just trying to silence me that it's pretty much disappeared, and they didn't ever send another one. But that's the extent to which they are frightened by the actions that the tenants are taking. And then they're trying to prevent me from supporting them because they know that when I support them, it gives them legitimacy. So the message that I take from that is, please tell everybody, number one, if they are feeling the threat of eviction, they should form a tenants union. It's really important because tenants can negotiate stronger together. And one of the people who is coming to the LTB to argue in favor of the tenants alongside me is Fred Hahn, who's the president of CUPE. And the reason he's doing that is because the landlords are trying to insist that they have the right to negotiate, to ignore the tenants union and only negotiate with people one-on-one. But what happens when they do that is there's a huge power imbalance. As you know, the landlords are very big and strong, and people get frightened and they sign these repayment plans that they can't afford. And when that happens, they can get evicted without another return to the landlord tenant board. So forming a tenants union, becoming strong is very important. It is the right of people to do that under the Constitution. And the landlords are in fact not allowed to refuse to negotiate with you as a union. So they're scared of the unions, and they're trying to break them up and to threaten me in order to help break them up. I'm just telling
Thank you.
No, so please stick together, be strong. Sorry for taking so long, but this is really
No,
important.
it's okay. It's important. It's very important.
Yeah.
You should not be afraid. We'll be with you, and we will continue this fight together.
Thank you, sisters.
Thank you, Rima. So today, actually, I'm going again another guest speaker. So, but he is Honorable Bill Blair, but he is not in here. So, but his representative Nahid Appa from his office, she's here. So, actually, Honorable Bill Blair was the first elected member of the Parliament for Scarborough Southeast in 2020. He served 39 years with the Toronto Police, and I'm just welcome Nahid Appa to say some words on behalf of Honorable Bill Blair's office. So
we have been received a video. We're going to play the video first, and then you can hear
Exactly.
1 minute from us.
Or I can say 2 sentences, then you can go to the video message. Is that okay? Oh, okay.
Okay.
thank you.
Okay. Good morning, everybody. And my name is Nahid Sharif. I'm working for the minister. The MP is Bill Blair, Scarborough Southwest. Almost, I think it's 6 years going on now. So, but that's not the problem. My issue is Sawro is really from my bottom of my heart. From the very beginning, I'm involved with this organization. We all together fighting for women's right. And honestly, I and congratulate and really appreciate to organize this forum that pandemic impact on every stage of women's life, like economic, mental health, everything. So it's a very crucial and right discussion forum. I want to thank Sultana and her team. And then, yeah, that's all. And I'm always with you guys, and always with Sawro. Thank you. Please go to the message.
Everyone. I'm Bill Blair, the Minister of Public Safety and Emergency Preparedness, and my most important role is as your Member of Parliament for Scarborough Southwest. I'm very happy today and honored to have the opportunity to join the South Asian Women's Rights Organization today for this important discussion on the impact that the COVID-19 pandemic has had on women, not only in Scarborough Southwest, but right across Canada. On March 8th, we marked International Women's Day, which was an opportunity to recognize female leaders, but also to celebrate the many accomplishments that women have made throughout our history. And on this day, we choose to challenge the barriers that women face, and we reinforce our commitment to striking these barriers down to build a more inclusive and fair society. One of the unique challenges that we have faced in the COVID pandemic has been the exacerbation of systemic inequities against women that exist in our society. It threatens to undo the many years of progress that women have achieved. And we know that this is especially true in the diverse, racialized communities of women like those in Scarborough Southwest. And that's exactly why I commend the South Asian Women's Rights Organization for hosting this important discussion. And while so much progress has been achieved, we must remember that there is more work to do, especially in the face of the pandemic. It's only by working together as a society that we can ensure that we build back better towards a more equitable community so that no one will be left behind. Thank you all very much. Thank you for Sultana for the kind invitation to join you today. I wish you well in this, and I wish you health and safety until we get the opportunity to meet again.
Thank you for this video. Thank you, Nahid Appa. So we can go back to our leaders.
Thank you.
Yeah,
Thank you. We will choose to challenge every oppression.
Yes.
Thank you, Nahid Appa. Wherever you are always in our Nahid Appa, okay? So now I will going back to again our community leader. So she will talk about the emergency response for Sawro for women and senior. Sayeda Sabia Yasmin Shapla. She's a community leader and peer worker in Sawro. She have been with Sawro is quite a long time from Sawro's beginning. She is very hard worker and she gives her all effort. She's giving still all effort in Sawro. So please welcome Sayeda Sabia Yasmin Shapla for talking about emergency response for Sawro for women and seniors.
Thank you, Jiniapa. Good morning, everyone. I'm Sweda Sabi Yasmin, one of the founding member of Sawro. I have been working as a member secretary since Sawro has started its journey as community-based organization. As a woman leader of the community, I feel proud to represent the living experience of social inequity of community women at all advocacy campaigns across Canada. I have been working with 150 national women leaders at a national level, along with Sultana Jahangir, to represent community perspective for gender equality at 2016 to 2019. Sawro is a women-led organization with the vision of immigrant women leadership and inclusiveness to raise gender inequity and intersectionality issue for advancing gender equality. We have some slogan, that's our slogan. If the women move forward, the whole community move forward. Since COVID-19 pandemic started at March 2020, Sawro has focused on making a contribution to the local, national, and global effort for containment and mitigation of the pandemic. Reorganizing social service, cultural, social, and advocacy program to address the pandemic crisis. Highest priority is facilitating communities people compliance with the necessary protective measure. During pandemic period, Sawro has consulted with precariously employed immigrant women. We have conducted over 1,200 follow-up phone calls with community women and their family to provide information about livelihood support programs and encouraging community members to share their concern and experience during pandemic period. Regularly convene online with community members, women leaders, and youth activists to talk about community members' experience, needs, accessibility, advocacy of health and economic support programs. Organizing community women leaders to carry out activities during the COVID response. Address communities' concern to respond and recover from pandemic crisis. Since March 2020, we have provided a responsive support to mitigate and containment and pandemic impact. Activate young women activists to support our organization along with community to build access and navigate hybrid service model. This group have activated to create an information bank and collect all up-to-date government and other COVID-related health and economic measurement information and circulate widely. Our very popular DWJNet become a very essential social platform for circulate information as fast as possible. Currently, we have more than 1,000 subscribers at this platform, and this year more than 15,000 viewers have seen all posts. We are also using other social media platforms such as Facebook, Twitter, WhatsApp, and our young women group have supported us to navigate these platforms. Our main communication strategy to make phone calls, 10 women leaders have activated since March 2020 for communication more than 2,000 members several times with required information. We have worked with community seniors aiming for increasing intergenerational bonding. We have worked with 130 seniors and support them to navigate pandemic impact. During this pandemic period, Government Emergency Response Fund helping us to support community people to meet their urgent needs. We have received funds from Red Cross, Toronto Foundation, and to provide culture appropriate dry food with PPE at community. Since March, we have distributed 750 clothing masks, 500 shield, and culturally appropriate dry food packets for among 300 communities people. I would like to express my special thanks to these funders and volunteers for their continued support to organization to respond communities' needs. We wish and request this funder to continue their support during the recovery of this pandemic. Thanks all.
Wow, that's a great job for Sawro. Salute to all community leaders in Sawro. We are so proud of you. So now I'm again, thank you, Shaplapa. I'm calling another community leader, Nadira Begum. She will tell us impact of the health measurement support from Sawro to community owner. So Nadira, community women leader, Dr. Nadira Begum. Actually, she is working in Sawro quite a long time, especially in pandemic. She's giving a tremendous support to the community through Sawro. So I want to invite Nadira Begum, Dr. Nadira Begum, with her space.
Thanks, Jinat Bashar, to give me the opportunity to talk over here. Hello, everyone. I'm Dr. Nadira Begum, a physician from Bangladesh. I've been working with Sawro for almost a decade as a community health advocate. Today, I would like to share my observation, research, and facts with regard to the COVID-19 pandemic and its impact on our community. According to the most recent figures from the Public Health Agency of Toronto, Canada's largest city with more than 2.9 million residents, people accounted for 77% of COVID-19 infection in the city as of October 31st, 2020. The agency also said 70% of all people hospitalized due to the COVID-19 infection were racialized. Mortality rates and mental health issues such as anxiety, depression, family disharmony, etc. were also high among those groups. Among those racialized groups, the South Asian community has been hit hard the most. As per data from Ontario Ministry of Health from April 30th to July 15th to 2020, the share of COVID-19 cases was 45.1% among South Asian people, as opposed to 22.9% among mainstream white people. The figure for this among Black and Latino community was 13.6 and 4.6 6% respectively. Now, based on my experience, observation, and research, I would like to highlight the major causes that plays role behind this scenario. According to the 2016 census, 52% of Toronto residents belong to a racialized group, and the vast majority of them are South Asian. Almost over 29.6% of visible minority and 8.7% of Ontario's total population. And many of them tend to live in a multi-generational households, meaning elderly members are at higher risk of exposure to the virus. South Asian people are more vulnerable to COVID-19 because they have higher rates of diabetes, hypertension, and heart disease, which puts them at higher risk of health complications. Asian people, like other racialized people, also tend to be overrepresented in precarious employment in the health, transport, and service industries, which involve coming into close contact with the public during the pandemic. Due to the language barriers, they are unable to access public health information as most of the information is broadcasted in English. However, as a community organization, we've put our best foot forward to help our people in the community. So far, we have responded by activating community health professional resources leaders. We have recruited internationally trained health professionals and undergraduate and graduate life science students to participate in COVID-19 containment activities. We have identified the underlying health conditions which increase vulnerabilities of community people of COVID-19 virus infection. We have shared and translated medical information obtained from public health institutions through communication networks. We've been also conducting Facebook Live and Zoom sessions on maintaining chronic diseases, the basics of COVID-19 virus, and its impacts on our health, vaccine awareness programs, and following Toronto public health measurements for health and safety. We have been supporting our community seniors in terms of accessing doctor's appointments and information about COVID-19 health services and vaccines. To cut the long story short, based on all of the discussion, I have a few recommendations. First and foremost, we need to collect disaggregated race-based data at the national, provincial, and municipal levels so that we can better understand and support South Asian communities in Canada across all social determinants of health, such as poverty, health, education, justice, immigration, housing, employment, so on and so forth. We need to involve more skilled people, especially internationally trained health professionals from the community to combat the COVID-19 crisis effectively and optimally. Information regarding vaccines and public health and safety should be translated into South Asian languages, including Bengali. More culturally appropriate programs should be introduced by community resource people to foster health protection and promotion. Thank you all, and I appreciate the opportunity to be here today.
Thank you, Nadira. Hands off you. So thanks. It's a nice presentations. And actually, we know we learn lots of things from you that actually what to go and how we will proceed in this COVID pandemic. So I want to invite another our community leader, Alisha Alam. Actually, Alisha is a community.
Jinia, I think Husna will go before Alisha.
Oh, I missed Husna.
Yeah.
Okay. Anyway, so do I go back to Husna?
Yeah, please.
Okay, sorry. So Husna Sweet, she's our community woman leader and peer worker from Sawro. So Husna, we discuss economic measurement support from Sawro community women. So let's welcome Husna. Husna also working Sawro quite a long time, and she is very active. Her involvement is very active with Sawro. So let's welcome Husna. Economic measurement support from Sawro for community women.
Thank you, Zinyapa, for the nice introduction.
I just want one second before you start. Okay. I just want to say after Husna finish, then Alisha will go. Then we're going to, because we feel it like we need to catch up the time. So after Husna, Alisha will going to continue do these things. Okay.
Okay. I'm Husna Sweet. I'm working with Sawro since 2015 as a community women leader along with others. Me and other precariously employed immigrant women have lived experience to work in discriminatory social policy and program, which empowered me to work as a leader to support other women of our community during this pandemic period. Among the community people, there has been widespread anxiety about the economic impact of the pandemic. Most people have already been hurt by wage loss and will expect more losses in the near future. Many people working for industrial temp agencies, casual, part-time, and in the fast food, retail, hospitality sectors have been especially hurt and have little savings to fall back. Families with young children have lost wages because of the schools and daycare centers closing. Through our ongoing interconnection with the community, we have found women face complex challenges, such as challenges to access government economic health and measurement due to lack of computer and language capacity. Challenges to follow turn to public health advice due to lack of initiative by employers, crowded transportation, and crowded living conditions. Unable to maintain online communication with others due to lack of knowledge and capacity. Severe challenges to access and maintain employment, loss of income. Domestic violence has increased due to partner intimidation. Navigation of accessing social benefits program system is very complicated and time-consuming that create complication to maintain the access of COVID-related pandemic benefit. During this pandemic, most women were laid off in December before the holidays and were not able to find job since. Mass layoffs in part-time and temporary works Many women had to leave work voluntarily to take care of their children when schools are closed. Those who continue to work face many challenges: childcare arrangement, unsafe work condition, intimidation from employers. Many community members, especially immigrant women, did not meet the criteria for the regular work-related benefit, EI, and also the temporary pandemic economic support, CRB, CERB, CESB, etc. Since March 2020, Sawro has provided responsive support to community women to mitigate the economic impact in various ways. Labor market and employment connection supports. Track definition of essential, non-essential jobs by health authorities. Track reopening. Assess if job offers are compliant with health guidelines. Support labor market entry, re-entry through employment connection and job trainings. Train job seekers about COVID-19 related workplace safety and health measures. Identify and establish referral connection with employers to comply with health and protective measures. Share hiring information through our popular networking website, DW JobNet. Workplace support. Equip vulnerable and precarious workers with knowledge about their workplace rights and protections. Support vulnerable workers to self-advocate at their workplace. Connect with other labor, feminist, and civil society organizations to advocate for the rights of precarious and vulnerable workers. Access to economic and social supports. Support community to access COVID-19 related economic support, such as CERB, CRSB, CRCB, EI, Ontario Works, OW, ODSP, etc. Connect community members to services and programs to meet their immediate needs, such as subsidized housing, social assistance, legal aid, etc. Previously, we support our community, and we will continue this support to our community until we are not fully recovered from this pandemic situation. Thank you, everyone, and thank you, Sawro, for giving me this opportunity.
Thank you, Husna, for your nice presentation. So I'm just welcoming Alisha. Alisha Alam has been involved with Sawro since 2012 as a volunteer youth leader and support worker. She completed her bachelor in social degree and currently completing her Master's of Social Work from York University. She is very active participant in Sawro as a young leader. So welcome, Alisha. Alisha is Alisha's presentations is standing beside us, stronger than hands-on support of community. Please welcome Alisha.
Thank you, everyone. Thank you, everyone, for inviting me here today to speak on the occasion of International Women's Day. Before I go on, I just wanted to go back in time a little bit. A month ago, on February 13, when we had the previous session, the patriarchy, migration, and gender equity discussion, and something that came up in that discussion was the importance of having intergenerational solidarity, both within, in the families and at the community at large. And in order to realize that, what we needed to do is we needed to create more we needed to have opportunities where we needed to rethink the way young women were, the contributions and the involvement of young women in supporting both their families and the community and the larger community, and that how all of that can contribute to uplifting and empowering our community. So I'm just going to so prior to the pandemic, young women were supporting some of the aunties who are here today and are speaking, some of the aunties who are here today, who are joining with us today as women leaders, to advocate for equitable reforms in labor and social policies that address the underemployment of immigrant women. And when I talk about underemployment, again, it's not only the skill underutilization, but the fact that immigrant women are working in jobs that are below the Canadian standard. These are precarious jobs. These are low-wage jobs. So that's what, thinking of underemployment, again, a bit more broader than skill utilization. And so when the pandemic, so some of the young women activists have been, very involved supporting the supporting like the ongoing consultations and recommendations, and the advocacy that was happening at the community level. When the pandemic hit, we were once again concerned that during this global health crisis, our communities would be left behind, which, to some degree, that was the case due to the lack of universal COVID-19 income supports. There were many people from our community who did fall behind. They fell through the eligibility cracks because of their employment status or their immigration status, and are continuing to having to face this global pandemic with minimal support. And so when we met in March 19, women leaders and youth activists came together with the aim of to be part of the local, national, and global effort to mitigate the impacts of the pandemic by supporting community members to ensure that they're taking the necessary measures to protect themselves and their families and the community. So where the pandemic had, and the nature of the lockdowns has the potential to re-isolate and re-isolate women and girls across Canada's, there's been a lot of, as women face disproportionate job loss and income loss, we wanted to ensure that during these crucial times, the full capacities and talents of women and young girls are being realized during these crucial times. And something that's happening in every household right now is the fact that you have young people, you have youth, you have especially young women stepping up to provide a range of supports. They're stepping up to make sure that their parents, grandparents have access to the technologies that they need to establish virtual connections. And as women, as some of the activists in the community have been working on right now, is to leverage these things that's already happening in our homes, in our and in our buildings, and kind of expand that on a larger scale and have it work towards community building and making sure that the community is protected. So since March 2019, many of the young women and community activists have been involved in discussions about how to best support our community during the global health crisis and to ensure that no one is left behind. Our role has largely been supportive. So again, with helping establish, helping get access to the technologies in order to establish the virtual connections that are needed to provide information on an ongoing basis, continue service delivery supports, and to be able to host some of the social and cultural events to bring the community together, even during a time where we have to, during a time of physical distancing, to ensure that no one is socially isolated. And so we have been working with youths in, we've been helping other youth support their parents and grandparents use the technologies that they have to access these virtual spaces. Young women activists have also been involved in collecting information on COVID-19 and the related health and economic supports and any other announcements that became available, because this information is often inaccessible to community members, and it's not always clear. So we would sometimes sit with the aunties here to kind of decode or to demystify and clarify some of the information that are circulating, and to make sure that our community is having accurate information. They're not falling for any kind of misinformation when it comes to either COVID-19 health supports or some of the income supports. We've also been part of analyzing what is going on right now to support what is going on in terms of the economic supports and the health supports, and trying to see where it's trying to see how adequate it is to how they can adequately meet the needs of communities. And we've realized that, again, as mentioned before, we've identified that there are gaps, and so there's continued advocacy efforts that young women activists are involved in alongside the women leaders of this community. And lastly, we've been also involved in some of the direct aid and direct service support by helping some of the women leaders find out where to get like PPE, sanitation, so that they can be given to community members who are struggling with securing things that they need to protect their health. We've also been helping out with some of the food, with making sure that community members have access to culturally appropriate foods. And just going to quickly wrap up there, but obviously there is so much more that needs to be done. We are as hard as it seems, we are only into the first year of the pandemic, and this is probably, going to last a little bit longer. It's, but what we need to do is make sure that all the work that's happening right now, all the discussions that are happening right now, do not disappear even after the pandemic, because as we are focusing on fighting for our rights now, we have to make sure that anything that gets like any kind of all these discussions still continue after the even after we're into the recovery phase, or even after it's declared that the recovery phase is over, because we know that this is going to have a long-lasting impact on our communities, both in terms of health, as many people are continuing to face the long-term side effects of COVID-19, but also in terms of economic security and social security as well. So going forward, our work is to make sure to be able to use more of the talents that are in the community, more of the capacities of young women in the community to support the community and work towards transformative change. So thank you.
Thank you, Alicia. Such a wonderful presentation. So I just want to say, Omen, you are so strong. You know that sense of pride you belong. You make it happen with your will. You go beyond the things to fit. Thanks, Alicia. So now actually one of Representative William, on behalf of Councillor Grady Crawford, I want to invite William to represent again Councillor Gary Crawford's message. Gary Crawford, Canadian politician who was elected to Toronto City Council in 2010 City Council election. Gray served in numerous committees including budget, planning, growth, economic and developmental executive committees. So and Crawford is serving 7 years for TDSB as a TDSB team. So welcome, William, from Gary Crawford office. Thanks.
Welcome, everyone. And first of all, thank you for having me here today. My name says William. William is my assistant, who I think Sultana and many of you do know, who arranged that. So just wanted to let you know I am Gary, the counselor. But William's always in the background. He's the one, if you need to get a hold of me, he's a big part of what I do in the community. First of all, I just really want to say right up front how honored and privileged I feel to be here with such a privileged and esteemed group of women. I've been online just the last number of minutes, just listening to some of the conversations. And I have to say, with Sultana and everyone with the South Asian Women's Organization, how critically important your role is, not only in the community, Scarborough Southwest, and in this part of the city, but just all over the city, and the work that you do on an ongoing basis. It's not always easy, and it's sometimes challenging, especially in the face of the pandemic that has been happening over the last year. But your advocacy and your work and your tireless efforts on the basis of the community, but also for not only South Asian women, but women overall, it's just remarkable what you do. So I just want to say up front, and thank you again Speaking as a male here with you, there's a sense of real esteem being part of this. And as I was listening to some of the words that some of you were mentioning, what is really important is the advocacy, as I said, that you've been doing, but more so is looking at the opportunities for change. I think, and we have talked, and you have talked about the challenges that we have all faced, but in particular women, over the last year with the pandemic, with some isolation, loss of jobs, loss of income, and how do you move forward? And there are challenges that I think all levels of government have been working towards and working on. But I think when I'm looking at one message is really, number one, it's a message of hope that this pandemic, this virus will be killed and we will move on. But then as we're looking at the challenges we've had and looking at where we move forward, where are those discussions on change? Where are those discussions on really looking at what do we do to make our communities and our society better? And I think there are opportunities. I have seen just in my role on the municipal level, more opportunities for all three levels of governments to be having conversations. And that's even at the city level. I do have the privilege of being the budget chair for the City of Toronto. And we have been, from a city's perspective, challenged financially. And we would not have been able to get through this pandemic without the support of the other two levels of government, which is, rightly so, their responsibilities in many ways. But what I have been finding in my conversations with the mayor and with the other levels is that opportunity for change, that opportunity to look at those bigger challenges that we have. Now, when you're looking at affordable housing, when you're looking at childcare, and gender equality, there are many aspects of these responsibilities that go beyond the municipal level. We as a city work incredibly hard when you're looking at childcare and increasing childcare, but that's only, we have a certain part responsibility. There are other responsibilities in the other levels of governments. And what I've been finding over the last year, and that's working, of course, on a local level with MPP Dolly Begum, and along with Bill Blair. But it's that connection and that responsibility between the three levels of governments to really look at what are the challenges and what are the opportunities and what is best for our municipalities, our cities, and our communities. And I think that is when you're looking at the opportunity as we move forward, is to have those conversations. And again, when you're looking at affordable housing, recognizing the challenges that we have in this city. We can do a lot as a city, we can do a lot as a community, but we can do so much more when we have those partnerships with the other levels of government. And I think out of anything, that has been the biggest opportunity, I think, moving forward that we're going to be having on many of these different challenges that before us. And again, I mean, it comes down to financial, it comes down to, our ability to be able to, if we're looking at services, for women, we're looking at mental health services, whether it's Access Alliance, providing the right kind of services. We need the resources, and through those partnerships that are really actually starting to happen. A lot of that has to do, frankly, with the leadership of Mayor Tory in the work he's been doing and advocating at the other levels. You will see. Again, we'll keep our fingers crossed. But as we get into those conversations over the next 2 or 3 years, those partnerships will do nothing but increase. And again, that'll come down to the city level, the community level, with more resources, more financial resources to be able to provide the services. But I think when we're moving forward, looking at COVID, looking at the pandemic, that will be when you're looking at the change that needs to happen at a municipal, provincial, federal, even world level. It's those connections and partnerships that I think will be absolutely key. And I think we, as again, even my role at the municipal level, looking at, we don't go to the other two levels of government saying, listen, you need to do this, you need to do that. It's the partnerships that we have developed. So when you're looking at the role that you play in the community, the role that the municipalities and all the other levels of government, that will be, I think, the testament to, if you want to call the opportunity that this pandemic has faced. We have the challenges, we have to get through those challenges. I'm hopeful we will do, but it's the change that comes out of that. And we may not know this for 2, 3, 5 years, but I'm hopeful that, those changes will be coming with, and again, with a lot of the organizations such as yourself, working incredibly hard to advocate and work with the other levels of government. And on that, again, just want to thank the South Asian Women's Organization for the work that you do. We do need, as government officials, as representatives of you, to listen. And we need to act based on what we hear, and we need to be out listening at all times to the great work that you're doing. So again, thank you very much for the presentation. And as I said, it's an honor and a privilege to be among a lot of very esteemed women. Thank you.
Thank you. Thank you for joining with us.
Thank you, William. Now we go back to again our guest speaker. So Christine Nugent. Christine is one of the best supporter of Sawro. We have long-time friendship relationship with her. She is our mentor and provides advice for social justice movement. Christine is lifelong activist to work with support group for injured workers, connect injured workers with consultations to assist with addressing workplace safety and insurance board WSIB issues. She is also a member of Ontario Network of Injured Workers, engaged in political action seeking justice for injured workers. Please welcome Christine Nugent.
Thank you very much. Happy International Women's Day week. I have attended many of the Women's Day Zooms and have learned plenty about the struggles that women are facing in Canada. Thank you to the women of Sawro for this opportunity to speak and for all the work you do and have done in the past year under difficult times. Sawro is a group member of the Ontario Network of Injured Workers Groups. I sit on their board of directors on the Justice for Injured Worker newspaper committee and organize the Barrie District Injured Workers Group. An aspect of raising the floor, as Sawro is putting forward, is to speak of workers' compensation as a right. In the last 48 hours, hundreds of workers have been sent home from the Amazon warehouse in Peel. Hundreds are sick from the virus there and throughout workplaces in Ontario. This is due to a failure of employers in the main to ensure health and safety conditions at work. All workers made ill on the job sent home due to health and safety concerns must file a workers' compensation claim. Workers' compensation is a right. The role women are playing on the front lines in the care economy, in caregiving roles at the workplace and at home, healthcare, education, and retail, and in the factories, food preparation and delivery, and in many other sectors, has brought forward the need to fight for the rights of all for many issues mentioned today. In the short time we have, I would like to introduce you, remind you of the need to discuss that workers' compensation when you are injured or made ill on the job is your right. For over 100 years in Canada, workers gave up their right to sue employers who deny health and safety in the workplace, and in return are entitled to full compensation for as long as your injury lasts. And that includes COVID-19. And there are long haulers who are not healing very quickly. This past year, during the pandemic, many workers have filed compensation claims, and we know of 800 that have been denied, with the compensation board saying that they must prove they got sick at work. With occupational disease like COVID, the government must recognize the principle of presumption, whereby if you got COVID as an essential worker, a frontline worker, a worker in a workplace that has not taken the issue of health and safety, PPE, and necessary measures to keep you safe, if ill, it is presumed it is from work and a claim must be filed and fought for. The presumption principle must apply. The WSIB is funded by employers. It is not a taxpayer social program. It's an employer funded program. It is one of the first social programs for workers in society that started over 100 years ago. Sawro, as part of the Ontario Network of Injured Worker Group, has joined in the Workers' Comp is a Right campaign that calls for government, the WSIB, to listen to your doctor's reports, to stop cutting of benefits due to deeming, whereby they claim you can go back to work when you're not ready, or that you can get a job when they aren't there, and to stop denials of claims due to preconditions that you may have. Finally, there are workers, mostly women under the pandemic, made ill on the job, who must be compensated fairly, and it is the government and employers' responsibility to do so. I don't have time right now to talk about two bills before the legislature, Bill 119 on deeming and Bill 194 on presumption, that are calling for important changes to the law. I will say that the government in Ontario has handed the employers several $billion in lowering premiums, and this has been on the backs of injured workers. I will post on the website where you can learn more, and in the chat. And now I would like to introduce to you Janice Murray of the Workers Center. Janice.
Hello, I'm here. Sorry. Yes, I'm bringing you greetings today on behalf of the Workers Center of CPCML. On the occasion of International Women's Day, I wanted to address the point that it is when women speak in their own name and put themselves at the table where decisions are being made that we are able to take our place. At the Workers Center, right from the start, we put all the measures in place so that women could participate in every aspect of work and of production, from running the printing machinery to graphics to all other areas. We participate in the decision-making on all these fronts. And when I speak right from the start, we're talking about the 1970s, when it was not yet the case as it is now that women worked as machine operators in construction and all sorts of fields like that. So at that time, we had the first woman first pressman in North America. I myself was the head of the bindery department, ran all the machinery such as folders, 3-knife cutters, as well as organized the work. And as well, I was trained on the press to run the forklift, as were other women. As communists, we worked collectively and taught ourselves what we needed to advance our aims. And because we did the work, we also trained other women in all these fronts. Still today, in many fields, women have to fight to be able to take their place. So at the Workers Center, because we were the ones who made the decisions on how the work was organized to put the human beings in the first place, we've been able to fulfill the aim of producing the publications needed by workers, women, and youth in each period. Today, these include the production of Workers Forum, which is a newspaper of the Workers Center, as well as other publications. So on the occasion of International Women's Day, the Workers Center greets all of you and the heroic work you do every day, many of you far from home, and at a time when government, which is called a model of democracy, treats you unequally and leaves you to fend for yourselves, while it serves the interests of paying the rich, to which the whole economy is presently geared. In these conditions, having an organization like Sawro is really important. It allows you to keep your bearings and together work out what you need to do to defend your rights in a given situation. This can be seen in how active you've been over the past year in the conditions of the pandemic to defend the interests of the whole community. And it was also true before COVID. Enforcing the demands such as status for all, paid sick leave, the right to refuse unsafe work, that frontline workers who contact COVID must be assumed to have got it at work and compensated. This is what taking pandemic build back into our hands means. It is our proposals and solutions based on our experiences which defend the interests of society which must be implemented. We can't accept less. And it is by taking the lead in ensuring this that women will play their critical role, as we and you and women in healthcare, education, and so many other sectors are doing every day. So once more, greetings on the occasion of International Women's Day. All of you speaking and acting in your own names are taking the future in your own hands. Our future lies in our fight for the rights of all, a fight in which women stand in the front ranks. Thank you.
Thank you, Christine and Janice. No one should left behind. Thanks for your nice presentations. So now I'm welcoming MPP Dolly Pagel, our guest speaker. Dolly Begum is the Ontario NDP Member of Provincial Parliament for Scarborough Southeast. She was elected to the Ontario legislation in June 2018 and in the first Canadian Bangladeshi origin to hold elected office at the level of Canada at the age of 29. As I believe, Dolly Begum is the youngest politician in her party. She is very popular with her work in our community. She is the role model of young generation in our community. So please welcome Dolly.
Thank you so much, Jinat Bashar. Thank you so much to Sawro for this amazing event. First, let me just say I was really enjoying listening to Alicia, the survey, and really focusing on some of the work and some of the struggles that people have been facing locally. Also, Christine and Janice highlighted for us some of the work that needs to be done. Just recently, we were speaking in the House about Bill 119 regarding deeming, and my colleague Wayne Gates has proposed the bill, and I'm so proud to support it, and we will make sure that we keep fighting to get this passed. So for, I just wanted to say that before I begin, because I think you all are the one that help us do the work that we get to do in the Ontario legislature to protect workers, to protect women, and to make sure that no one is left behind. I must say, when I found out the name of the event, I thought this was perfect, because during this pandemic, we realized that we were looking at first COVID response and now COVID recovery. But there is always this element of the idea of women or children that gets forgotten. And I think when we look at recovery, sometimes we forget the idea that if we look at any sort of recovery, but without doing that, and from a feminist perspective, from a perspective where women are at the center of this comprehensive plan, that recovery will not work. And as the MPP for Scarborough Southwest, I have had the privilege of working with some incredible women who have come forward, strong women who have come forward to share the struggles that they are facing. First, I must say that this is, during this difficult time, in the beginning, one of the first things that I learned as the critic for early learning and childcare was how important childcare was during the middle of the pandemic. As the pandemic began, we were trying to fight along with organizations to make sure that there was emergency childcare, because how important that was to the idea of running the economy. And it had pointed out the reality of this essential service that I don't think many politicians, especially our ministry at this time, understood the same way before. And that was really particular. I remember March, April last year when we were on the phone with the Minister of Education saying we need to have childcare. Otherwise, our healthcare workers cannot go back to work. And what the truth was that these essential services, these healthcare fields, whether we're talking about hospitals, any sort of giving spaces, it was primarily women. And that was something that is the at the center of this struggle that we are facing right now. When we talk about PSWs, when we talk about our nurses, when we talk about any sort of retail jobs, any food sector, for example, it is women who are now making sure that the economy is going, and also women who have lost their jobs. And I don't have to give you statistics. You are the one who are helping us, find out what's happening in our community. So I just want to say that I realize what's happening and will continue fighting. I have to say that even before this pandemic, I have seen the work that Sawro has done throughout to support women. Sultana Jahangir, the entire team of Sawro, and even the young ones who I see from leading the events, doing the organizing in the back end, have done a remarkable job supporting women. We were trying to help people from a cosmetica to other, congregate settings where workers are facing a struggle. They also don't have the ability to come forward and share their struggles or speak out because they're afraid of losing their jobs. Sawro was there from the get-go. And I'm so incredibly proud to have a strong organization that was there. Before I became an MPP, I remember the work they were doing for childcare. And this has just continued. And I know that it's a small but mighty organization. And sometimes with limited resources, you do such amazing amount of work. I also want to thank all the supporters who have been supporting Sawro, and whether it's injured workers, for example, in any sort of advocacy organizing way, because these are the groups that we need to support to make sure that they continue to do the work that they do. There's a lot of work ahead. I'm hopeful. I'm also anxious because I know the struggle that we face in the Ontario legislature. So I want to thank all of you for this event. I want to thank the entire team and wish you all a very happy International Women's Day or Women's Week, and tell you that I'll be with you at any point of any time to support from my end. So thank you very, very much.
Thank you, Dolly. It's a wonderful way you said about us. Thank you. Okay, Zinia, can we go next one, please? Thank you.
Thank you, Dolly. Actually, is a wonderful words to hear. Actually, Sawro work a lot for the community, for in every ways, like senior, junior, all the job purpose. It's a tremendous work last 1 year. So thanks for recognizing us. So now we have guest speaker, Nasima Akhtar, Executive Director of Bangladesh Canadian Community Services, BCS. So Nasima Appa, she is also popular in South Asian community, especially for her involvement in the past decade. So welcome. I want to welcome Nasima Akhtar, Executive Director of BCS.
Good afternoon, everyone. Thank you.
Sorry, Nasima Appa, apni mute hoye geche. 1 second, Nasima Appa.
Sorry. Yeah, good afternoon, everyone. Thank you, Sultana Appa and Sawro, for inviting me to this event today. My solidarity to all women in the world. And especially the Sawro work, what they're doing, this is really tremendous. I heard today, the whole day, what especially during this COVID, what work you are doing. And this is really the good information for all of us who are working in this community services. We can use your information, what you have presented today. So thank you for all this information. So we all know that COVID has different kind of impact in human lives all over the world. It's in terms of economic, mental, physical, and everything. And then when you talk about the women actually the more sufferer, and that we have double impact during this COVID, because we work at home, we work outside home, and then now, as Dolly said, that okay, women are the one who actually lost job. And we actually have now double responsibility. We are at home, we have to take care of our child, we have to take care of our family member, and then everything we have to do at home. And at the same time, you have mental pressure, you have physical anxiety, and many, many things. So everything we have discussed. So there is nothing more to add from me. So as a response from Bangladeshi Community Services, we started during the COVID, immediately we started with our limited resources, how we can help our community. We started with this grocery support and home service especially for the seniors. We distributed PPE for the seniors in the first round with the funding from United Way. And then we got another funding from United Way and also from the Ontario government to give the PPE for the essential workers in Taylor Massey area. And we have also the grocery support, especially for the needy families and for the seniors. Along this, we are running this our virtual session for the not only for the seniors. This is for all the people who are actually homebound, who cannot go out now. And our program is running like for the people from all over the world. Actually, they are joining our therapeutic exercise and recreational activities every Tuesday, Thursday, Friday, and Sunday. These 4 days we are running these activities. And not only that, as Alisha also said that, this our young generation is actually more important, and they are playing crucial role in the family and also in the community, and try to find the need of the young generation. So we are also engaging our young generation. We have this intergenerational engagement to keep this both generation, not only both generation, actually the family and all the generation together, keep lively and enjoy while they are at homebound and they are in these sufferings of this COVID situation. And apart from this, we also have the South Asian helpline in partnership with CASA, where you can call if you have any kind of need, any kind of information or any kind of help with the food basket or any other help. You can call that line, and then you will get support in 8 languages, South Asian languages. And as all of we are saying that, okay, nobody will left behind. And Sawro is the pioneer. I say that in our community, that you are bringing all the women together, not only the women, all the organizations who are working in our community. So thank you, Sultana Appa, for recognizing all of the community members and our services. Thank you very much.
Thank you, Nasim Appa. You see that how important the community organization, because community organization is the main resource to support the people to come out from this COVID-19. I'm requesting all community organizations has to be fully funded to work in the community. Thank you, Nasim Appa.
Thank you, Nasim Appa. So actually we want such like you as a community leader, so we can work together. Now we have another guest speaker, Hasina Kadir, President of Bangladesh Center and Community Service, BCCS. Hasina Appa also a community leader. She worked a lot in our Bengali community especially, but she is involving in every ways to help the community. So welcome, Hasina Kadir.
Hello, can you hear me?
Yes.
Okay.
Yeah.
Okay, so Assalamu alaikum everyone. It's almost good afternoon, and Hasina Kadir representing Bangladesh Center and Community Services, in short BCCS. We are very similar to BCS and BCCS and very confusing. Sorry about that. But however, I can see that you can make a clear distinction when you are actually asking Nasim Appa and myself. So thank you for that. So again, happy International Women's Celebration. We already have one, and last week also Sawro joined us. It was a good collaborative activities. So thank you again for inviting us to be here today. And wow, we learned a lot today. A lot of activities is going on behind for the women folks in this area and also for in generally. So we all know that the importance of women in our lives. The crisis generally hits everyone. And this time, the pandemic hits all over the world. And we know that the crisis is never been a gender, it always never has been a gender neutral thing. It always hits more to women than men. We know that this is a general thing, and we heard a lot about this today. And also the work that Sawro does, as I say, I echo with Nasima Appa that it's really, really tremendous. And we salute you, the work that you have been doing for this community to help the women. So during the pandemic, what we have been doing just to, as a crisis response, starting, we are almost finishing on our project, was March 19th. And then we were told that nobody wanted to come to the center because of COVID. So right away, we we thought it was for, I think, about a couple of weeks, we kind of kept quiet. We didn't know what to do. It was so much uncertain situation and anxiety. So what we did, we thought that we have to be resilient. What we can do to help, what we can do. So first we started to make some phone calls to our senior population, to our vulnerable women or men who are members of the community, to see that how they're looking at, how they're managing with this. And then slowly we started to receive some funding from United Way and from provincial government and also federal government to run some programs, which was a really, really great help for us. So what we could do at home, we realized that it affected the seniors and also the other community very adversely. The number one, that we all heard about losing the job. That's something that Sawro provided very detailed information. We don't have to really go through this, but we also realized that there are a lot of women, they actually haven't lost the job, but they have other difficulties that they're facing. They're so vulnerable because they didn't know how to handle this. They were social isolation. They had a lot of other health issue. So in order to do this, so what we did, at Nasima Appa just mentioned, that we started the virtual programming. What we could do, we started to talk first. So we actually started um, even virtual programming in terms of doing meditation, then yoga, and then chat sessions, and which actually covered a lot of health topics, mental health topics, a lot of other issues. And we also started to help many community members to complete the EI application and also to do the survey application. So I think that we all thought that we need to help them in any way. It doesn't matter which way, but you have to help them in any way. But the funding really helped us to provide the services in a very structured way. So we did that, and we also thought that the what Nasima Appa was mentioning, that food insecurity was very prominent. So we also started to do the grocery based on the needs. So we actually did about 160 people. We did the grocery to meet their immediate needs. We also, in partnership with Wadenur's Community Center, we used to do halal food delivery to about 40 to 50 vulnerable seniors and vulnerable adults in the community. And our program, we actually divide into three parts. One group is seniors, and one group is vulnerable, one group is senior 70 plus. And then all three groups are getting services starting from Monday to Saturday. And every day something was happening, which really helped everyone, all the participants, to be not only to be together, to talk about their daily lives, to get some health tips, and then get a lot of information session and how to become healthy and how to be less anxiety, reduce social isolation, things like that. So together, we are all doing something to help our community, our sister, our brothers, and our community people. And I just want to say something about the women, that through this program, we wanted to be more resilient. We wanted to become our people more empowered. And the one interesting thing, that through our 4 programs, running programs, about 140 participants, 100 participants are women. Just to see the ratio, that how many men came for the services and how many women came for the services, right? And then and also, as you know, that at home level, women are so good in multitasking. Without women, what can run? Nothing can run, because the men only can do one thing. If you ask them to do something, they only understand one thing at a time. But the women, they are doing multiple things together. So that's why the women has to be more organized. Women only can make a difference. Women, all leaders behind the men, the women is working very hard to make the men leaders. So right now the time has come that the women should help women. So women should be the leader. That we can see Dolly here, that she's so powerful. She's bringing some insight. She's bringing some empowerment for the women and especially our young folks. So thank you so much. I don't want to say much. We all know that we heard a lot. And again, thank you so much for inviting us. And we will all work together to help our community and moving forward. Thank you.
Thank you, everyone. This is a very wonderful, fruitful discussion. We see that everyone bringing the deep information from down to up, and let us understand that how important to work together in a collaborative. And thank you, Hasinapa. Thank you, Nasimapa, that we work together. All of you that you are attending right now. Thank you for this. We have a plan to go for the recovery discussion because we are getting the dissect the impact. We already talked about that, how the response is happening by the community's resource, by our own hand, that collectively we try to keep in a safe place so that we all can survive. So right now we want to open this discussion. Before we open the discussion, I would like to just see that we might be extended a little bit more time because our plan is to finish in 1 o'clock. We might go more than 20 minutes. So is it okay with everyone? So before we go for that things, I just want to do a little refreshment. One song that we singing the last year, we just want to play for this thing because I just want to refresh our memory that how lively we are before and how energetic we were before. Please be with us. Okay, so you see, we have to, protest together for the right of the women. So all of the when you discuss it, you see that women born to start their fight. As soon you're born in your family, you have to fight for the right inside in your family. Then you go to the society, you have to fight for your voice in the society. So every sector women are fighting, and all over the world, every corner, every place, the women are fighting. So the fight will never finish. Our previous leader fight, we are fighting right now. So every time we are fighting, and our fight is to bring the social justice and equality for the people, equality for us. So we see that we have a big storm happen in the society. That is the COVID-19 pandemic. When the storm is coming, we do not know before the storm comes that how it will going to damage our society. But we collectively working here. Because the organization like Sawro, like BCCS and BCS in here, we are able to create some kind of fence for the community. That here we are working together, to holding each other hand, to protect our community from all of this impact. The impact that we lost a job, impact that we lost our economic support, impact that we lost our loved one, impact on our health. Every single day, the worry that am I going to be survived? What will happen? If you go to the shopping, as soon as you come back, you have a fear that I might get this pandemic, I might get this virus. Every single day we feel that we might lose our loved one. In the same time, our mental and physical health is totally grinding. And that time, Sawro, BCS, BCCS, that community organization stand beside the community, say, here we are, we're going to together survive. So these response when you do it, and now still we are in the pandemic, we are not finishing the pandemic. Today's number is 1,300. And we get another warning, we might go to the third wave with the new variants of the virus. This is not good, this is not the okay. We are still responding. And recovery is not like, okay, we can build a house and it's finished. Recovery is going to take a long time. This COVID-19 virus, pandemic, and the poverty pandemic, and complex inequality situation and issue create a big scar in the society. And this scar will not going to be relieved or done within a very short time. It takes time. It might be takes 10 years because we are getting 10 years back right now with one hit of this COVID-19 pandemic. But how the recovery should have to be. Your house is totally destroyed. This is storm, destroy everything. It's vandalize everything. Now we all need to work together to build back better. We don't want to build back like before. We want to get build back better, like the new world. Inclusive, equality, and voice from the bottom to up. Someone said this thing, what is the alleviate platform means? Alleviate platform means that our basement is oversupply with the racialized, with the immigrant women, those who are living in a very inhuman condition under Canadian standard life. We want them to march and move forward and support them to alleviate the platform so they can go to the Canadian standard life. So these are the work we're going to start to do right now. So this recovery discussion, I want to request all of you, we're going to give 1 to 2 minutes. So just let us know that what kind of recovery we want. So from my right side, I want to go from Christine. Christine, can you please tell me that what kind of recovery we should get it this time?
Well, I think you've put it well that 10 years ago, you said that we have set back 10 years. But what's missing in that comment is the 10 years of building organization. So we are different now than 10 years ago because of organization and the importance of continuing to build that organizational methods that Sawro has worked out. Because you mentioned that the community, that there needs to be funding for social programs, there needs to be funding for community organizations. So that aside, that doesn't stop us from sticking to what we've learned the last 10 years of how to organize and how to build community and how to listen, stand up, speak out on behalf of the community. So yeah, I think we're in a good frame now with the support of all the people that's on this call and all the organizations, and we need to continue to tell our, you know, to put our stories out there. I think Janice is eager to have more stories in Workers Forum. I think that there's a lot of stories that were mentioned here today and a lot of hard work in terms of the data that's been collected and the conditions that women workers are facing in the region. So yeah.
So I would like to hear from Janice also, please.
All right. I mean, I think the main issue, Christine sort of hit on it, but it's going to be the strength of our organization and the strength of our numbers to actually organize. I think one of the important things for us will not to rely that the government is somehow going to solve the problem, because in the end, they're in the service of these multinationals and so on, and in service of paying the rich. And as long as we recognize that we have to keep our independent stand, and that we have to work together like in the organizations and so on to identify and to see how we organize, how we move forward, then we'll make progress. It's by working people being able to actually enforce the demands they're making, like healthcare workers being able to insist that the measures that are needed are taken, and people in the organizations insisting that because it's not that we don't know what's needed, it's that we're not getting any cooperation, if you want to put it that way. So it's a matter of us enforcing our rights. It's a matter of us, continuing to organize. And certainly Sawro is an example of how to mobilize women and the whole community to see how to defend everybody's rights. So a lot of these demands that come forward with status for all is not a sideline demand. It's a demand that's needed in order for all of us to have the rights we need to have a Canadian standard of life, and so on. So I guess that's what I would say.
I would like to go for Stephanie Frenzy. Can you please let us know what kind of recovery we need right now?
Well, I think it's important to, in thinking about a recovery, that we have an equity lens in everything that we do. I mean, a lot of the problems that we've been discussing were really highlighted by the pandemic, but have been known to us for many, many years. I mean, we have so much research showing the negative health impacts of precarious work, the inability of workers to exercise their rights. From the perspective of a researcher, I would say that we need better data to support our advocacy. We need community-based research to really bring forward the voices of racialized women, particularly. We need data to support our initiatives. Often community-based research is limited because of resources and the scope as well. So we need to have partnerships between researchers, community organizations, politicians, and others to make sure that these problems are finally addressed, that we do rebuild better. There's just too much evidence showing that that the pandemic has disproportionately impacted individuals who were already struggling. So I'll let others comment on that as well, but I think that we need strong, better data to support our initiatives, and we know what to do, but this is how it works. We need to be able to document it to be able to support this advocacy. Thank you.
Thank you, Stephanie. So I would like to go, Rima, please. Can you please just say within 1 minute that what kind of recovery we need?
Sure, I'll be very brief. We absolutely need an equity-based recovery. Again, it's not, the pandemic has highlighted these crevices, these gaps, but they've always been there. And I think we have to understand that we have to begin by understanding that society has to work for everybody. And I think one of the things, absolutely, community organizing is absolutely key. It is the only thing that is going to work. I think it's crucial that we push back against the idea that paying fewer taxes is the answer to everybody's problems, because that's where the conservatives win. It doesn't work. We need to invest because it's cheaper for everybody in the long run if we do that. And so it's up to everybody in community to actually mobilize and organize so that we can all work together to push against this nonsense that the right-wing governments are pushing at us. Thank you for having me and for all the work you do.
Thank you, Rima. Sorry for this. We'd like to hear from Dolly, please. 1 minute, you just tell me that what kind of.
For sure. I think some of the people before me have pointed out some great points. I just want to have one example, which is was it yesterday or the day before yesterday, we heard that a company that made over $21 billion of profit last year was too cheap to protect their workers, that now we have hundreds of workers who caught COVID And I'm talking about Amazon, and the fact that this has happened within the GTA, and this is what we're facing. And we know that there's other factories locally in Scarborough that were doing similar things, and mainly women who work in these spaces were being affected. So I think it needs to be, there needs to be multi-pronged approach to this. There's where we're making sure that these organizations, these institutions are held accountable. They need to pay their taxes, they need to pay their dues, and make sure that our government is not working for them, but they're working for the people of this province, for this country. And that goes back to organizing, making sure that we're mobilizing in numbers, the work that you're doing, and we just have to make sure that we empower each other and strengthen each other so that we can continue building back better. So absolutely continue organizing. Thank you so much.
Okay, thank you, Dolly. We want to hear from our community's women leader. Okay, what do you think, like what do we expect and what kind of recovery we need? So please, Sayeda Yasmin Shapla.
Sorry, 1 second. Okay. Because we recommended that current minimum wage is below living expenses, and women are affected severely by the wage for during pandemic period. The consensus is poverty and below Canadian standard life. We recommended minimum wage must be equal to living cost. Thank you.
Thank you, thank you. So I'm going to go Husna Sweet to say something. That what kind of recovery we want?
Thank you again. Actually, I have lived experience to work in precarious labor market, and I know how these labor policies are working before pandemic and now. So my recommendation and request to all level of government to focus on a very strong and inclusive labor policy that reflect communities, especially women's needs to maintain a Canadian standard life. That's my recommendation for.
Thank you, Husna. We want to go Kishore. Kishore, can you please tell me what kind of recovery agenda you think?
Yeah, thank you, Sultana. You already mentioned that basement is overflowed. I like that comment because yes, this is true. The basement of employment situation is overflowed. So I want that when policymakers make some decisions, make some laws, the why the racialized immigrant women's situation is not a reflection of those policies. So already Dolly Begum and MPP Rima also mentioned that yeah, they are focusing this situations like few companies situation they are saying in the parliament. Yeah, this kind of more things are happening with the racialized women. So these things should be focused in the parliament. We want that as a women leader from the community. I want that.
Well said, Kishore. I want to go for Hanapa. What do you want from the recovery in this pandemic period?
Actually, I'm so much worried about the housing. When we are earning $1,800 and we are paying $2,000, how can we manage a healthy lifestyle? It's really beyond our imagination. So at this moment, something must be done to make it affordable so that we can pay our rent, and at the same time we can buy our essentials, right? We have to survive. That's the thing.
Thank you, Faranapa. I want to go Nadira Begum. What kind of recommendation or request do you have?
Well, as I have mentioned earlier, that we already have gaps and inequity in our community, and the pandemic has exposed this terribly to us. So as a physician, I believe that we have resources, powerful resources, health professionals in our community. We need to activate them. We need to include them in the mainstream so we can contribute more and strengthen our health sector and move forward as a better nation. Thank you.
I would like to go Jinat Bashar. Jinia, can you please let us know that what kind of recovery should be in that period? Jinia, you are unmute. Can you please unmute yourself? Sorry, you are muted.
So I think everybody covered for all the recommendations, but as a as a early childhood educator and as a center supervisor, I would recommendations that it should be accessible, affordable, quality childcare for everybody. So this recommendation should come because we see in this pandemic time, so women lead the world in every sector, like nurse, doctor, or whatever see, educator, teachings, professions, all the result in COVID pandemic, we women are there. And when women take the lead, we see the positive result. So my recommendation is that the universal childcare for everyone's.
Thank you, Zinnia. I want to go Nasima Appa. Nasima Appa, please let me know within 1 minute that what kind of recovery we should get.
Thank you, Appa. So definitely it's no doubt that we need to recover from this COVID-19 and it's a huge impact we have. So as a community organization, what we have seen that we know that without funding, we cannot work most of the time. So what we have seen, all the funding, what is coming for this community work, all are for the big organization, for consortium. This grassroots organization like me, Sawro, BCCS, we cannot actually even qualify to apply for those funding, but we are the one actually working in the grassroots level. And we know that what is actually cultural specific services we can provide and then how we can reach our community, how we can outreach, we have that specialty. But unfortunately, we are not recognized in the mainstream level that we are working for this community, and then we are not qualified to get those funding. So there should be some, I don't know, I mean that there is Rima and Dolly here, and then I wish that Gary Crawford was here, because most of the funding from the city, nowadays we are not qualified to apply. So there should be something that how this grassroots organization can access to those funding. There should be some policy on that. And the other thing is, we all know that there is discrimination, there is racial biasness in policy level, even in job market and everywhere. But to get rid of this COVID situation, we need to get the equal access to all these resources. Thank you.
Thank you, Nasima Appa. Very well said this way. I would like to go for Nahid Appa as a Bill Blair, Honorable Bill Blair representative. Would you like to say something about this recovery for 1 minute?
Oh, sure. So thank you, Sultana. I just want to say that we definitely bring our voice, or raise our voice, and also try to challenge every oppression, every inequality in our society. We women build the society, so we need to be together in collaboration, work and fight for that to protect our right.
Thank you, Nahid Appa. I'm going to go Alisha Alam to say that what kind of recovery we needed right now to build back better society in future.
Something I say at every event is everything, like society needs to be organized around the needs of those who are the most vulnerable, those who have been left behind. And that should be the main goal, and that should be the primary way that our society should be organized. That includes making sure everyone has access to not only affordable but decent housing, that everyone has access to sustainable and dignifying jobs, that everyone has access to healthcare and the healthcare that they need, not just not like excluding vision or dental care. What also needs to be happening right now is we need to be building cross-community solidarity. So Oak Ridge, Teasdale, Taylor Massey needs to be working with Kiel. Needs to be working with communities in Kiel, in Jane and Finch. It has to be working with communities in Parkdale, across the GTA, and hopefully across Canada. We need to be working with our Indigenous communities as well, because our interests we can fight for our interests together in a collective way. That's something that I really hope that the women leaders in our community and the emerging youth leaders and youth activists can help work towards.
Thank you, Alisha. Thank you. Only one principle of a human right can bring everyone work together, that it is not acceptable that we are going to be left behind. Together, we're going to make a better society. Just want to say, my dear community, my dear all women leader and everyone, we want to work together to make a society that we don't need to receive every single day a phone call that I cannot tolerate any more domestic violence. I don't have any house to live. I don't have any food to eat. My children do not have any good future. We do not want to hear these things. And we don't want to say that my life is worthless. I came in here to work in the slavery labor market, to bring my bread and butter, to see that my children are going to get a better society. No, every woman needs to put a strong footprint for their future generation. We deserve Canadian standard life. We deserve to work 8 hours in a day and bring enough money to pay our rent, pay our food cost, and have a very wonderful life and civic engagement. We do not say that we want to be a millionaire. We just want to live in a Canadian standard, and that could be possible if the policymakers listen us. We need our authority for this changing mode. We need our leadership, our hand over there. We don't want to be a participatory present over there that I'm going to come and do the deputation and give you my all experience and need for the community. No, I need my hand to be the construction firm. I need my hand to fix the policy. I need my hand to say over there, this is not correct. We need universal childcare right now, not half measurement things. The universal childcare means every woman deserves to keep their children in a safe place, but they are going to get quality childcare, and every woman free from all of the burden to go and upgrade themselves and invest their work in the society. Thanks everyone to join together, and thank you everyone to be the part of this thing. This discussion will be the mild follow, will be one of the big steps to moving forward for the next one. So we'll come back again to work together. For today, happy International Women's Day to all of the women, and build back better today. Thank you.
Thank you.